Good morning, everyone. Good afternoon. We're going to wait a couple of minutes for people to join, and we will start then. In the meantime, if you want to say hello in the chat and write down where you are coming from, then that would be really lovely. Okay, I think we will start now, and if people are still joining, then they can catch up while we are introducing everything. So good morning, everyone, and good afternoon. Welcome to our webinar on the Commonwealth Partnership for Antimicrobial Stewardship, Cpams. The webinar is about the extension program. And thank you very much for joining today. And as I just said, if you want to introduce yourself in the chat, that would be really, really great. You should be able to see the screen, and you are all currently on mute, so we are not able to hear you. But if you have any issues with seeing the screen or with your audio, you can put a message in the chat. The recording of the session will be online with the slides, and we will send an email as well with the recording to everyone. So don't worry if you can't stay for too long, or if you have issues with connectivity. We will have some time at the end of the session for questions. And we will also try to have a short networking session at the end as well. And I think that's everything for housekeeping. So yeah, if you have any issues or any questions on the audio or anything, then you can ask anything in the chat. And I'm going to introduce myself. So I'm Audrey, I'm from THET, and I'm joined by my colleague Jess from THET as well, and by Diane from CPA. And as I mentioned, today we will talk through the application process for the Cpams extension funding that was launched recently, last week. So I'll start with a quick run through of the agenda for today. We will start by an overview of the Cpams, and then we will present key information about the extension program, including eligibility criteria, and we will highlight some of the things that we are looking for in an application. Then we will go through the programmatic requirements, support and resources, and before detailing how to complete the application form, the budget and the annex. And we will finish by talking through the application process and the timeline. And hopefully at the end, we will have plenty of time for questions. And we will also open a breakout room for each country at the end after the questions to allow participants to network and discuss with potential partners. So if you're still looking for a partner, we are encouraging you to join one of the breakout room at the end. And if you have any question on the presentation, then you can add the questions while you are listening to the Q&A box, and we will address them at the end of the presentation. Okay, so let's start by with a quick overview of Cpams. So the Commonwealth Partnership for Antimicrobial Stewardship, which we call Cpams for short, aims to leverage the expertise of UK health institutions and technical experts to strengthen the capacity of the health workforce and institutions in Commonwealth countries to address antimicrobial resistance challenges. And the program seeks to engage the UK health sector in a program that harnesses UK health institutions and professionals in partnerships with low and middle income countries counterparts. The scheme is funded by the UK Department of Health and Social Care Fleming Fund, which is a 265 million government commitment of official development assistance to support countries in collecting high quality data relevant to antimicrobial resistance that can then be shared and used nationally and globally. And by supporting the collection of this AMR surveillance data and other relevant data, we'll collectively be better able to understand the scale and scope of the problem of AMR, and therefore we're better placed to tackle it. If you need, if you'd like any more information on the Fleming Fund, you can check their website. We will put the link in the chat box, and you can see the link on the screen as well. So the first round of Cpams ran from 2018 to 2021, and it focused on 4 countries, which were Ghana, Tanzania, Uganda, and Zambia. And the program aimed to tackle 3 of the 7 Fleming Fund objectives that you can see on the screen in blue. So these were developing and supporting the implementation and protocols and guidance for AMR surveillance and antimicrobial use, advocating the application of data to promote the rational use of antimicrobials, and collating and analyzing data on the sale and use of antimicrobial medicines. And this was achieved by using the well-tested methodology of health partnerships, which were partnerships between the UK health institutions involved in the program and health institutions in the 4 countries, so Ghana, Tanzania, Uganda, and Zambia. UK and LMIC health workers volunteered their time to co-develop strategies and share skills and knowledge to address priority health system issues. And in this case, this was related to antimicrobial stewardship. And the CPAMS scheme was the first global health partnership to require that pharmacists in the UK and also in the LMIC countries involved to be included in as essential members of each global health partnerships. And in tandem with the CPAMS program, where the Health Education England funded the first Chief Pharmaceutical Officer for England's Global Health Fellowship Program for pharmacists. And this was run by CPA, and Diane will present this in her slides later on. The CPAMS program provided mutual benefits for both the in-country health workforce and institutions and the UK teams as well. And the UK teams specifically, for instance, developed project-related and leadership skills and gained a new understanding of global issues and how to find innovative approaches to tackle these issues in real resource-limited settings. So in terms of the management of the program, CPAMS is delivered jointly by THET and CPA. So if you don't know THET and CPA, THET is a UK-based global health charity, and we have been managing donor-funded projects to strengthen health systems and human resources for health for over 30 years. We have developed partnership in healthcare, health management, and training, and enabling people in low and middle income countries to access essential healthcare. Additionally, we have a grant management services, but on top of that, we also run health system and health workforce capacity development programs in 6 countries. And on the other hand, the Commonwealth Pharmacists Association, CPA, is a UK-based charity that advances health, promotes well-being, and improves medicines-related education and use for the benefit of the Commonwealth, by supporting the development of safe and effective systems of medicines management, maximizing the skill level, and encouraging the better utilization of the pharmacy workforce. CPA seeks to encourage the optimization of medicines and health-related advice given to the public, with the aim of improving health outcomes and reducing health inequalities throughout the Commonwealth. So that's the presentation of THET and CPA, and as we are delivering the program in partnership, there will be an overlap between our roles, but THET will oversee the application and grant giving process, including the negotiation of contracts and drawing of mail and project plans, for instance. During project implementation, we will also provide support for project planning, financial management, resolving project management challenges, risk management, as well as reporting and monitoring, evaluation and learning process. And then CPA has the technical oversight and leadership of the program, and they will provide targeted technical assistance to health partnerships to ensure that the projects are in line with the expected outcomes of the scheme. Their support will also include the provision of options to support baseline and post-intervention assessments, for instance. Also support with using Cpams tools and resources that we mentioned in the call for application documents. And I will also provide support for technical preparation of health partnership and planning in-country activities as well. So we have mentioned the health partnerships approach. So a bit more detailed on that. Health partnerships are long-term partnerships between UK health institutions and their counterparts in LMICs. Within these partnerships, UK health workers volunteer their time to co-develop strategies, share skills and knowledge to address locally defined health issues. And in this case, these issues will relate to AMS. It's important to note that this model is a mutually beneficial model for the health workforce and for the institutions, both in the UK and in the LMICs, sorry. Usually, a health partnership begins through an informal or personal connection between individuals in two institutions, and then they decide to widen this connection and to work together on a project and to formalize and institutionalize the relationship, and then that marks the beginning of the health partnership. In the call document, we make the distinction between new partnership and established partnerships. So a quick definition of that. For established health partnerships, we said that they have been working together for over 6 months, and that they are formalized and institutionalized, and that they can clearly demonstrate adherence to our principles of partnerships. We will put a link to that in the chat. And on the other hand, a new partnership has been working together for less than 6 months, or they have not started working together, but they have intentions to do so. We have developed some guidance for new partnerships that you can find on our website. And we aim for CPAMS specifically, we also have created a survey to collect a list of partners that are interested in starting a new partnership. And we are regularly circulating and updating the result of this survey. And we are trying to link partners that way. Okay, so I just mentioned the principle of partnerships. So it's 8 or 9 principles that we expect partners to commit to when they form a health partnership. So I won't go through all of them now, but for instance, you can see on the screen, I will pick the harmonized and aligned principle, for instance. So this means that partnerships need to make sure their work is aligned and consistent with local and national plans, and that it complements the activities of other programs and partners working in the same context. Partnerships need to be supported by senior management in each partner institution and seek to engage with national regulatory bodies to build long-term support for the project. So again, we have a full page on our website detailing the principles of partnerships. So it's quite important that you have a look at them if you're not familiar with the principles. For the CPAMS extension, both newly formed and long-established partnerships will be eligible to apply. And however, only the established partnerships that have been previously funded through CPAMS can apply under the category B. So that's something to keep in mind. So in terms of the achievement of CPAMS to date, as I said, the program ran from 2018 to 2021, and there are some key outputs and outcomes achieved during the program. So for instance, partnerships have established and strengthened medicines and therapeutic committees at implementation sites. They have trained healthcare professionals in IPC, such as hand hygiene, for instance. And they also have strengthened links between wards and microbiology. So these are some of the outputs and outcomes from the first round of CPAMS. You can also see on your screen that we have funded 12 partnerships and trained more than 3,000 health workers, and a lot of volunteers have participated in the program. Now we are going to talk about the CPAMS extension programs a bit more. So under this extension, a total of £250,000 is available for health partnership. And the funding will be available for partnerships operating in Ghana, Kenya, Malawi, Nigeria, Sierra Leone, Tanzania, Uganda, and Zambia. As I mentioned briefly, the program is split into two categories. Category A is for partnerships that are newly formed or long established, but that have not been awarded a CPAMS grant before. And category B is for partnerships who have previously been funded through CPAMS. Both categories can apply for funding in the range of £10,000 to £20,000, and the project should last between 6 to 7 months. And we will detail the required activities for both categories later in the presentations, but note that all projects must take into consideration the scoping recommendations that we have mentioned in the Q&A documents. And finally, the project focus. So the project that we will fund through this round of grants should focus on antimicrobial stewardship, including surveillance. So this is a mandatory focus. They should also focus on utilizing and developing pharmacy expertise and capacity. This is also mandatory. And they can focus on infection prevention control and on strengthening capacity of using clinical microbiology data. So these two focus are not mandatory. And now I will hand over to Diane for her presentation, and she will start with the objectives of the program.
Thank you very much, Audrey. Hopefully you can hear me. So in terms of the objectives for the program, I think this has been highlighted briefly already, but just to share with you that there is an importance in focusing on improved knowledge and practice related to antimicrobial stewardship prescribing, antimicrobial prescribing practice within the institutions and with the workforce. So both capacity building and as well as transfer of knowledge. That we are developing effective antimicrobial resistance and stewardship interventions. There's a strong focus on stewardship, but we're very aware that to tackle AMR, we need both IPC and stewardship interventions. With use of standardized tools and guidance, we're really wanting to avoid duplication of efforts or reinventing the wheel. And that NHS staff also demonstrate improved leadership and understanding of the global context. This is important because obviously the funding is coming through the UK aid, so we want to be able to show benefits back to the NHS. Next slide, please. And then what outcomes can we expect, or do we expect, is again highlighting that prescribing practice, the use of microbiology data to inform decision making. That didn't have as much of a strong focus in the first CwPAMS, so we're really hoping to strengthen that this time around, particularly with established partnerships. And then antimicrobial, there's a strong focus across Fleming Fund for surveillance, the core focus around microbiology surveillance, and this provides an opportunity for us to focus on surveillance of antimicrobial use. So we do not expect microbiology surveillance or the surveillance of the microorganisms in this context, or resistant infections in this context. We're really focusing around antimicrobial use. Obviously, if you are doing a PPS, for example, that may include healthcare stated infections as well. And then infection prevention and control, for recognizing that to tackle AMR, we need both. We expect that protocols and tools that are available are implemented rather than reinventing the wheel where they are available. So if there's a national tool available, that we use that in the first instance. If not, we go with an international one. And then we can see there that we are moving for a partnership approach across the UK, going from the UK to the 8 countries. And we can see there where we've got existing partnerships already and where there'll be new ones coming through. Next slide, please. And then we conducted a scoping process over the last few months, and that's what has informed what is in the scope in the call for evidence as well. So we've used a rapid evidence synthesis approach to the scoping that included assessing published literature, but also focus groups with the support of technical in-country advisors, and also colleagues from the national antimicrobial resistance committees within the 8 countries. There were 21 One Health stakeholders, so we really did that in a One Health approach. Although the focus for CwPAMS, the primary focus for CwPAMS is around human health. And we had multiple commenters and reviewers of the scoping reports. So we are working through finalizing those reports for publication. But in the meantime, we have used the information from them to inform the call for applications. Next slide, please. And then some of the highlights from the scoping is that all countries have developed a national action plan that we have. And this reflects the prominence of the issues within the country. We know that there are, and we knew this from the last call as well, that there are notable numbers of infection prevention and control and WASH initiatives within the countries and within institutions in the countries. Obviously, there can always be more. But there were quite a few of them already funded projects around those. And there was a notable increase in digital health across the 8 countries as well. And there's inclusion of pharmacists in the development of the NAP, although that could be strengthened. Next slide, please. But the gaps that we highlighted was that there's paucity in documented evidence on antimicrobial resistance and antimicrobial use surveillance, antimicrobial stewardship, and then monitoring and evaluation of the National Action Plan implementations. There's increased political motivation to tackle AMR, but we want that to be matched with the technical workforce capacity and expertise to do so. And this is where CwPAMS can really provide that support to increase capacity with colleagues. And then we made specific recommendations. There were specific recommendations made, and we've copied and pasted those into the call for application. So I will not go through those at this moment, but you can see within those is that it focuses, and it's really trying to summarize information from the 8 countries into one, so that we can have a programmatic set of recommendations rather than for each country. And one of, just to highlight a couple of them, is around the importance of increasing the number of health facilities with antimicrobial stewardship programs, and increasing the capacity of the technical working groups on antimicrobial stewardship. So you can see there where we focused our attention in terms of developing the requirements for the CwPAMS program. And it's encouraging the One Health research and collaboration is as part of the National Action Plan. And one of the key points that we noted in the new countries was that there was a need for easy access for prescribing information through an app. They were aware of the CwPAMS app that we'd created, and so there was a request for that to be supported. And there's some work ongoing through other programs to see how we can support and make that happen. Next slide, please. And the importance of considering behavior change and what are the barriers and drivers for antimicrobial stewardship and antimicrobial stewardship interventions within the institution. Obviously, I cannot go through this now, and anyone that knows around behavior change knows that in itself, even an hour would not be enough to do this. But what we can say is that in the induction program, we will build more of this in, and we provide some support at a programmatic level. But what we also do is that in developing our tools and resources, we try and build in behavior change strategies within them. Next slide, please. And then considering the workforce distribution and capacity, so we know that there are pharmacists within the countries are fewer than the pharmacy technicians, for example. So it's considering actually the pharmacy workforce as a whole. So as CPA, we focus on pharmacists, but it's really important to know that in many countries, there may be more pharmacy technicians. And so how can we build the capacity for those colleagues as well? And also considering if there are other influences to prescribing or medicines use. We know, for example, in some countries that there are nurses who are involved in the medicines dispensing process. Next slide, please. And then I highlighted this earlier, the importance of not reinventing the wheel. There is a range of tools and resources and policies already available. And so if a country has its national program or policy, then we really should be trying to support the implementation of that rather than shoehorn in other countries' protocols into those institutions. If they don't, then we need to be considering if, for example, WHO has a policy or guideline that can be used. And then we've also over time developed CwPAMS tools and a range of tools from the first program, and I'll go through them later on in the presentation. Next slide, please. Again, considering how you approach the partnership. So in this context, you've got the healthcare worker in the center, but you've also got the local healthcare environment, and then you've got the national healthcare environment. So you need to consider that as you develop the projects that you for CwPAMS, and really thinking through what is the capacity within healthcare workers. We're really careful not to overburden the healthcare workers within the institutions, but also thinking about their healthcare environment and then the national healthcare environment. So in terms of the national, we have considered the national action plan, and it's great that all the countries have a national action plan. And by the very fact that you are carrying out CwPAMS we've been quite specific in the requirements, that helps to support the national action plan implementation within those institutions. But also, as I'll talk about later, the Antimicrobial Stewardship Baseline Assessment is again helping you to consider the local healthcare environment. So in developing your project plan. Next slide, please. There are some other things to go through in the next couple of slides. I would just very briefly touch on things. So thinking about the multidisciplinary team. So this is really about multidisciplinary team. Whilst pharmacy remains at the center and in a core part of it, that we do expect multidisciplinary approaches. National Action Plan I've talked about, incorporating IPC, although it's an optional section to it, but partly because also what funding is available. But I think there are opportunities to build IPC training into any capacity building, and consideration for e-health, obviously the low resource restraints as well, and the behavioral approach. Next slide. How can you enhance systems capacity? That may be challenging within the time frame that is available, but considering how do you build the health systems. And then there are tools to support clinical implementation, and then building antimicrobial stewardship as part of the clinical role. We're very pleased to hear that for some of the partnerships last time, because of CwPAMS in some countries, and in particularly Tanzania is one example, but there are a couple, and Zambia, the clinical pharmacy as a service was formally developed and launched after the CwPAMS programs went into those institutions. Next slide. Again, the checklist for data gathering. So we have provided you with some tools for data gathering, and we're recommending the global PPS as an example for point prevalence survey. So really trying to use evidence-based approaches in terms of developing that. So the global PPS is an important tool that we recommend, and it's part of the call for the projects, but also the Stewardship Assessment Tool as an example. So again, we're really trying to avoid duplication of efforts. We're trying to avoid reinventing the wheel, and we're trying to limit the extra work that needs to be done to support you in developing the projects and also implementing the projects. Next slide. So in the key questions to ask within your project is, how does it build the healthcare workforce that you are working within, and both the skill set for both the UK colleagues and the in-country colleagues that you're working in? And how does it build capacity to collect evidence and monitor antimicrobial use to ensure progress in antimicrobial stewardship is measurable? One thing to highlight is that where CwPAMS fits in the wider Fleming Fund is around data use. And so really that's we are seen as a program that really collects data, but most importantly makes use of that data at a clinical stage that benefits the patients. And does it provide healthcare workers with the necessary training and tools to overcome behavioral barriers to inappropriate prescribing and dispensing, for example? Next slide. I'm going to hand over now back to, I think it's Jess, to continue from here, and I'll be back again soon. Thank you.
Great, thank you, Diane. So now going back to the call, so thinking about eligibility and selection criteria. So core requirements and country eligibility. For this grant call, there are several eligibility requirements. We'll go through these briefly now, but you can refer to the Q&A document online for more information on each of these. So firstly, projects must operate within one or more LMIC health delivery institution and community pharmacy in Ghana, Kenya, Malawi, Nigeria, Sierra Leone, Tanzania, Uganda, or Zambia. Applications for category A must be made by partnerships between a UK health institution and an LMIC health institution, which have not previously been funded by the CwPAMS programme. Applications for category B must be made by a health partnership between a UK health institution and an LMIC health institution, which has been funded together previously through the CwPAMS programme. Grants are for single time-bound projects that are deliverable within the budget and time frame proposed and agreed with THET. At application stage, all applicants must complete an AMS assessment using the CwPAMS AMS Assessment Tool, which is provided in Annex 1 of the application documents. Diane will explain this a bit further, but we'll be requiring you to complete this at the same time as your application form so that we know that the intervention you're proposing is rooted in need and shows evidence. Letters of support from each lead partner institution must be submitted along with the application. For institutional eligibility, in order to be eligible for the CwPAMS Extension Grant, UK and LMIC institutions leading a health partnership must be either from a health delivery institution, health training education institution, or academic institution, regulatory body, or professional membership association. There must be a clear joint leadership from an NHS hospital or trust, and it should be clear that some members of the deployed staff will play a clinical pharmaceutical role. Private for-profit institutions are not eligible to apply except LMIC community pharmacies, who are eligible to apply as an additional partner. LMIC private not-for-profit institutions, so for example, private not-for-profit hospitals, will be eligible to apply as an additional LMIC partner. Non-governmental organizations, or NGOs as we call them, are not eligible to apply as a lead partner for this grant. However, we acknowledge that some health partnerships have a charitable arm to support fundraising activities, and these charitable entities are eligible to have a role as a managing agent for the grant. The applicants must be able to show that the capacity development activities of the project will be delivered by the eligible UK and LMIC health institutions and not the NGO. For partnership requirements, there are a few requirements that you need to know about for the partnership themselves. So stakeholders in both the UK and LMIC, including pharmacy on both sides, are actively involved in the project design and management. The partnership has a clear understanding of how other health partnerships and other health actors operating in the field and is taking opportunities for learning and collaboration, as well as avoiding duplication. The partnership demonstrates commitment to the THET principles of partnership, which we mentioned earlier in this webinar. The partnership has the capacity to deliver the project, and the UK institution can evidence effective AMS within their own institution and effective AMS interventions overseas if applicable. For project requirements, there are a number of project criteria that you'll need to meet in the application. So you can see these on the slide here. These requirements form the selection criteria for the projects and the partnership. So applications will be systematically assessed against these. So always try to keep them in mind when you're filling out your application form, as we'll be looking for you to demonstrate how you meet each one of these throughout the form. We won't go through each of the requirements now, but we strongly advise for you to refer to these closely in the Q&A document, where they're explained in more detail for each criteria. It might also be a good idea to keep a list of these in front of you as kind of a checklist. So when you're going through the application form, you can check you've included each of these. Some of the criteria will be explicitly linked to specific sections of the form, whereas others are not designated sections and are more kind of demonstrated throughout several sections of the form. Just remember that never assume that THET or CPA know your partnership or projects that you've delivered in the past. So we want to hear about these as if we don't know about them in the form. It's also not a bad idea to have someone outside of your team to read through the application just to check for any sort of mistakes and check that how well you've responded to the requirements. We advise you to fill in the application form before the budget template in order to avoid missing out any key costs. I'll now pass over to Audrey.
Thank you, Jess. So now moving on to practicalities related to developing the budget and the funding restrictions as well. So please keep in mind that PERGEMS will not be funded by the project. So we will fund training and capacity development activities. So for instance, catering for training, but we will not fund PERGEMS. We can also fund national and international travel in economic class. For international travel, please note that because of COVID-19, there are some restrictions for travel, and the trip need to be appropriate and justified, and needs to be in line with CET's COVID-19 international travel policy, which we have shared in the call documents, and we can share as well with you by email. And obviously the travel needs to be in line with the regulation, international regulation, national regulations, all of this. And we will not fund international travel for less than 3 days because of the environmental impact. In terms of the project equipment, a maximum of 50% of the grant total can be used for the equipment. For project management, you need to include this cost in the budget as well. Up to 40% of the total budget can be allocated to project management, and this includes staff time, but also office costs, for instance. We expect that the expertise should be delivered by volunteers, but we can accept a small percentage of the grants to be allocated to trainers' fees. So it will be up to 10% maximum, only when it's absolutely necessary. So for instance, if there is a particular technical input that cannot be provided by a volunteer, then we will accept 10%. If you're not sure about this, you can email us and we can discuss. You also need to include monitoring and evaluation costs within your budget, and this could account for up to 40% of the grant total. We have also allowed 1.5% for contingency, and this is in the project management category. So this is for instance, exchange rates or bank charges. And note that the grant will not fund entertainment costs, the delivery of health services, and PERGEMS, as I mentioned. And in the budget, you probably have seen that there is a line for GC, so gender equality and social inclusion activities. So you can allocate a portion of your budget to ensure that the activities are taking a gender sensitive approach. The awarded grant holders will be expected to carry out a number of project management processes and activities, and you can see them on the screen. Now, we also have listed them in the Q&A document, I believe. So I will go through the key parts now, but yeah, you should refer to the Q&A document for more information. The contracting activities will include the completing our due diligence process, where we will ask successful applicants to complete a form where we can check whether your policies and governance documents. You also need to confirm the phase budget during the contracting period, and you will need to sign the contract. So we will sign the contract with the lead UK partner or the lead LMIC partner. And then the contract signatory will then be responsible for transferring the grant to their partners. So THET will transfer the grant to the contract signatory, and then they must distribute the funds to the partners appropriately. Then during the inception phase, so the first 2 months of the project, you will be expected to attend a virtual inception workshop on the program. And this is scheduled for the 14th of October in the morning, UK time, 9 AM to 1 PM. You are also expected to develop a monitoring and evaluation plan and finalize your project plan. You will also develop some policies if you don't have them already. So for instance, a safeguarding policy or a procurement policy. And you will need to sign a memorandum of understanding between the partners if it's not already in place. And finally, you are expected to attend an individual inception meeting with THET and CPA. And over the course of the program, there will be ongoing monitoring and reporting. So you are expected to reply to any question we may have on your progress, and also notify us of any challenges that you are encountering. And you are expected to attend a mid-project progress meeting with THET and CPA again. It will be, I think, around February time next year. And finally, at the end of the project, we are expecting a narrative and financial report. So the narrative report will include output and outcome data, gender disaggregated direct beneficiary data, volunteer input data, and the financial report will include a detailed transaction list, and we will also spot check some of the receipts. And finally, you will be expected to attend a final event at the end of June 2022. It will be a sharing and learning event with all of the funded partnerships. So that's everything for the program requirements. So I'm going to hand over to Diane now.
Thank you, Audrey. There have been some questions, and I know we've been typing the answers, but I think some of them are worth talking about now before we go back into more details. So there was a question about how does one identify a favorable partner in the UK? And I know Jess has responded that there is a link to a survey where we can broker new partnerships. I'm not sure if all participants can see the Q&A section. So maybe Jess, if we can copy that link into the main chat as well, that would be helpful. There was a question. Yes, we will be sharing the recording and the slides. I think that's come up a couple of times. There's a question about can individual pharmacists in the listed countries apply? And individuals cannot apply to THET or CPA, to THET and CPA directly. It needs to be institution and it needs to be a partnership. What we know has happened in the past is that individuals who are very interested and passionate have found a partnership that exists and volunteered their services or been part of that partnership. And then there was a question from how about UK academic institutions without clinical pharmacists? You will need to find a pharmacist, a frontline pharmacist within your project, and so would recommend that you link up with an NHS institution or a pharmacist who works within the NHS, or a community pharmacist if community pharmacy is part of your project. What's really key about this is that they're frontline who understand stewardship within the institution and can share that learning with colleagues in one of the 8 countries. So I think those are some of the Q&As that have come up already. So I'll go now moving to my session. So in terms of what are the required activities, because of the short timeline that is available, we need to ensure that we have a way to support and from learning from the previous CwPAMS monitoring and evaluation, as well as from the scoping, we've been quite focused with what is expected within this CwPAMS, and hopefully makes things a little bit easier as well for colleagues to still make a important impact with considerable less stress, hopefully. And we are very aware that there is still a pandemic in progress. So we're really trying to limit what's the stress and the burden on colleagues. So we've requested that for both category A and B partnerships, that an antimicrobial stewardship assessment is completed and submitted as part of the application stage. I'll go through the stewardship assessment tool at a later stage in the presentation, and that you conduct and feedback data on at least 1 point prevalence survey, and that's the global PPS survey. And also that you develop a 2 to 3 years antimicrobial stewardship action plan, taking into consideration the stewardship assessment, point prevalence survey with support from CPA. And with the action plan, we're not expecting the action plan to be obviously implemented. What we're wanting to see is that an action plan has been developed and ideally gone through the governance processes within the organization to say what can be done in the next 2 to 3 years within the organization. Partnerships will also be expected to develop and sign a memorandum of understanding. I think that's been highlighted already. And then towards the end of the project, to conduct and submit a post-intervention stewardship assessment. Obviously, these are the required activities. There are other activities that you, through completing the assessment, you may choose to focus on. We'd expect to see some training occurring, particularly around the global PPS, for example. Category B only can roll out their CwPAMS initiative to another health institution in their vicinity. So if they have previously worked in one institution, then they may want to expand to additional institutions. And we know the last year for the CwPAMS, the CwPAMS 1, I guess, we had some partnerships we worked with 2 institutions each. So there might be an opportunity to do that. Yes, I've just seen a question about action plan is institutional. Yes, the action plan is institutional. And then incorporate One Health element into existing outputs and outcomes, or also to branch out to community pharmacy. So really, we're not expecting category A partnerships to be branching out to community pharmacy at this stage, although if there are opportunities to do so, the core focus is really around the secondary care and the hospitals, delivery institutions, and then you can move into the community as well. Embed, they're working to strengthen capacity for clinical microbiology. So this is really how do we make better use of laboratory data and diagnostics data and bring that back into clinical practice. Next slide. And the technical support available, we've got tools, so some of them have been provided as part of the application process already, but we also have, for example, the volunteer tool, and we've also in the past developed tool like a survey that you can use at the end of your training sessions to assess knowledge, attitudes, and behavior. So we have these tools available that you're welcome to use. Behavioral frameworks are available, and there's some work on, and you'll see those through the tools when I present them. We can provide links between organizations, resource toolkits we've talked about already, training sessions and workshops on how to approach the project. We've got the induction event, for example, but we also have in the past at request developed webinars on particular topics if it will be useful. And throughout the projects, there's monitoring and evaluation support, training sessions and webinars I highlighted already, and then access to expert assistance by email. Next slide, please. So now going into the tools and resources, there's a wealth of tools and resources, and that's available as Annex 2 within the call for applications document, and it is a PDF document which currently sits on a Google Drive. So there are some information, and it just starts off with about the Commonwealth Partnership. So you have information from THET, CPA, and also the launch webinar from the first 2018 CwPAMS program, as well as the extension. So it's really just a collation of information on there. Next slide. I'm going to go through. There's the app, so that's been one of our important developments as part of the CwPAMS. So there is an antimicrobial prescribing app where the national prescribing guidelines or standard treatment guidelines for the 4 countries, Ghana, Uganda, Tanzania, and Zambia, already exist. Actually, for Zambia, we have taken off the Zambia prescribing guidelines because the previous one that was available at the time when we developed the app was, I think, 2013, if not, 2013. So we've taken that off now because Zambia has recently published its standard treatment guidelines, and we're working through the process of uploading the new version that it was literally published less than 3 months ago. And then WHO essential medicines list, infection prevention and control resources, PPS tools, as well as stewardship guidance. So that it's really, and we've also now included some information for community pharmacies as well within the app. So we're really trying to build it beyond just a prescribing app to also include antimicrobial stewardship information. Next slide. There was a game. This caused a lot of excitement when we had the shared learning event, and this is an online and a physical board game. And if you go onto the amsgame.com, if a colleague can just put that link into the chat, you will be able to see some information about the online game that is now already available, and we're hoping to launch the physical board game in November 2021. And partnerships will be able to request for one of the board games to be available in the in country for use. So this is something for you to consider as part of opportunities for training. We found that using this method has been found supportive in training without people feeling I guess tested. Next slide, please. We also have a toolkit that we developed from the previous CwPAMS program and projects. So the 12 partnerships developed a wealth of information, because at that time, actually, there were fewer tools available. Certainly when we started CwPAMS, the WHO PPS did not exist, and they did not have an antimicrobial stewardship policy or document. That now all exists, but that's all collated into the toolkit, and also examples of training that took place within the institutions, examples of committee terms of reference. They're all available in that toolkit. I'm going to touch very briefly, or I'll come back to that shortly. I was going to talk about WHO PPS, but I think I have a slide on that. And then in terms of behavior change, the Change Exchange in Manchester, who we've been working with, are developing a digital toolkit on behavior change resources that partnerships can make use of as well. Next slide. And then we've developed some explainer videos. So this is again an opportunity to educate using a different approach. And so we have 4 explainer videos that we're developing. One will be on what is antimicrobial stewardship. One is around the patient experience with antimicrobial resistance, and then we follow a continuum of care, really bringing in the roles of multidisciplinary colleagues within that. So nurses, doctors, pharmacists, laboratory and microbiology teams, and antimicrobial stewardship committees. And then we also have one on surgical continuum of care, really focused on the journey of a surgical site infection with care workers' roles within that. So with these, it's really thinking about how can you include them as part of your training resources or implement them within that. Again, really trying to reduce duplication of efforts, really trying to reduce burden onto the partnerships. Next slide. And then we have a CPD platform, and this is at the moment is specifically for pharmacists, but others can also access that. And it's bite-sized modules of 30 to 60-minute sessions on antimicrobial stewardship, but it includes antimicrobials overview, so really detailed information about the different antimicrobials and mechanism of actions for antimicrobial resistance, the principles of antimicrobial stewardship in community pharmacy, antimicrobial stewardship in hospital with us in the hospital programs. And with all of them, there is a baseline assessment, and at the end there is a final test, I guess, quiz, out of each stage there is a certificate issued to those who complete it. So again, if you've got pharmacists within your partnerships, this may be one for you to recommend that they complete if they want to take their learning to the next level. Next slide, please. Last year, this is an example of a bi-directional learning, and this came about, this video on how to manufacture alcohol hand rub came about with the Zambia partnership. So they had worked with colleagues in Zambia to support in the development and manufacture of alcohol hand rub. And because of that partnership, we then got more funding from the Commonwealth Foundation, Commonwealth Secretariat. And we were able to develop a training program on how to manufacture alcohol hand rub, and that's available. And again, with this partnership, there was a real example of bi-directional learning that we really shout about and share consistently, because bi-directional learning is really important. And by that, we mean that colleagues in the UK bring back learning from their colleagues in one of the 8 countries. And this was when, during COVID, we became a resource limited setting and we ran out of alcohol hand gel. And so colleagues in Brighton were able to produce their local hand rub because of the learning they had and as part of participating in CwPAMS. Next slide, please. And then the assessment tool, so that's part of the call for applications, and I'll go through that later. But we actually had this assessment tool as part of the previous CwPAMS program, and so some colleagues would have done that. However, what we've done this time around with the previous one, WHO did not have a tool available, so we used international consensus. There was an international consensus document that we used as our starting point, and then we went back out and carried out a consensus process with colleagues in the 4 countries. This time around, we have taken the WHO tool that has now since been published, but updated that with some key specific CwPAMS program from the learning that we have. And so that's what that tool is about. Next slide, please. I think I'm almost at the end now. And then training and webinars, with those are quite a few of them that are available already, and that again, the links to that are available. The GESI, which is Gender Equality and Social Inclusion, really recommend that you have a look at that training, and you can skip through to the relevant sections, but there is a section that talks about how do you apply GESI within antimicrobial resistance and stewardship. And then for we've got the shared learning events again that you can have a look at, so you can see some of the projects that colleagues have done over time. The CPHO fellows, so that's the Global Health Pharmacy fellows, the recordings from their graduation is available. Again, 5-minute slots that they all had, but 16 of them focusing on the projects that they have available. With the PPS training, what I wanted to highlight there is that we went through the differences between the WHO PPS and the global PPS, and we provide explanation as to why global PPS is what we are going to be continue to support. And the brief reasons for that is that you can get immediate feedback that you can provide to clinicians. And also with WHO PPS, what's the key part is that your country, the government, has to invite you to be part of the WHO PPS, whereas with the global PPS, anybody can participate in that. So that's why we are recommending that the global PPS. Obviously, if you're in an institution where the WHO PPS has been recommended and you're in an institution where the government has identified that institution to take part in the WHO PPS, do let us know, because we can work with you to support that to happen, because the training for PPS, the principles are similar. And also with WHO PPS, I believe that countries will sometimes have their own team that will go into those institutions and collect the data. So there's a range of information around that on there. Next slide, please. And then just wanted to highlight that CwPAMS has been recommended and as the program was a winner of the Antibiotic Guardian Awards in 2020. However, in addition to that, many partnerships also got highly commended or were winners of different Antibiotic Guardian Awards, and you can find out more about them onto the Antibiotic Guardian page. And just wanted to highlight that Africa CDC, so the 8 countries that we're going into are in Africa. Africa CDC have got a formal collaboration with the Antibiotic Guardian campaign, and there is a page on the website on pledges specific to African to colleagues in Africa. So that may be a consideration for you to think about, is how do you build that into that. And as many of those in the UK will know already, with the Antibiotic Guardian campaign, it's a pledge-based, a behavior change campaign, which encourages people to choose a pledge about how they will make better use of antimicrobials, and then they can publicly share about that. And we found that over time, people that are antibiotic guardians tend to go on and do more in tackling antimicrobial resistance. Next slide, please. And publications, dissemination and sharing of learning is really key for us. And that's one of the things that Fleming Fund talks about in terms of the CwPAMS program. We have more than 14 peer-reviewed publications already. We would want to see more of that happening. We do not want our results to sit on platforms that cannot be used and support others in developing projects. So we will encourage you to consider that. And in the last program, we did fund some partnerships to publish in open peer review journals. But if that's of an interest, do let us know. We do ask that for publications that THET and CPA have sight of it before it is published, and when it's been at the point of submission, and that there are clear lines that we have agreed that need to go into all the publications to acknowledge the funding. Next slide, please. I think that should be the last one. Yep, and there are news articles as well. Next slide. Okay. Thank you very much. And in terms of why we should get involved, I think might still be me. Is this still me, Audrey?
Yes.
Okay, that's fine. So why should you get involved? It's an opportunity to develop innovative solutions to overcome barriers to antimicrobial stewardship. So whilst we've been quite specific in some of what needs to happen, actually within that framework, you can innovate, and we have seen great innovation happen through that to improve leadership capacity, to improve your understanding and use of digital technology, and this is going to be even more critical now with COVID and not being able to travel. Frugal innovation is really key, and something that we do at a programmatic level, and we know happens as well at program and partnership level. Expand non-clinical skills repertoire. We know definitely that many clinical colleagues that have been part of the partnerships have previously did not have formal project management or finance reporting or development of management and evaluation documents or outputs and outcomes. And so that's some of the feedback that we've had. It's been challenging, but actually found as being useful. Expand your understanding of stewardship in the context of global health, and then opportunities for professional development, research, and sharing of learning and publications. Next slide. And I think the next slide is really just to very quickly highlight the Global Health Fellowships for Pharmacists. Again, there's a publication on this, so I won't go into detail, but just to say that we evaluated the Global Health Fellowship, and I can see some of the fellows online. I don't want to name those I can see, just in case there are others that I can't see online. And the evaluation showed that there was an increase in confidence, increase in communication skills, management skills, and attitudes. Some examples that we had were people that were ready to resign and leave the NHS, but because they were able to get involved in this program and to be part of the fellowship, they had invigorated and really have stayed on. And what's been really exciting for us is that 5 pharmacists at the time of the evaluation received promotion, and in fact we know that there's been additional promotions since then, and significant promotion as well for a couple of the pharmacists. And really it's been really, for me as someone who led this part of the program in terms of the fellowship, in collaboration with other colleagues, I have been so humbled and just blown away by the impact of the fellowship on colleagues. And that learning for us is that we've now scoped for what a leadership program may look like for colleagues in the 8 countries. And we're really now just working through how we secure funding to make that happen. We've also gone back to ask Health Education England for the opportunity to continue the fellowship for the pharmacists who participate in this round of CwPAMS. So we are just working through that process. So it's to highlight that, pharmacists that are involved in this, there may be opportunities for them to be awarded the Global Health Fellowship. They have to do quite a bit of work to be awarded the fellowship, but then once they are fellows, they graduate as fellows and can use that as part of their CV for life. Next slide, please. Okay, back to you, Audrey or Jess.
Thank you, Diane. So now we're going to run through the application form, highlighting some areas of interest, but a lot of questions are self-explanatory, so we won't go into too much detail because it's quite long. In general, throughout your application, form, it's good idea to avoid using acronyms or explaining the acronyms and technical terms, and to make your application as readable as possible. And also you should respect the word limits when we provide some limits in the questions. So let's jump into the partnerships section. So next, yeah. So on questions 2.1, we want you here to tick the boxes that best describe the lead partner. So I think someone in the chat box asked a question about the institution that can be involved in the program. So as you can see, or maybe you can't see because it's quite small, but we are expecting that the UK partner be either the lead UK partner be either NHS trust or hospital. They can also be an academic institution or health training institution. So that could be, for instance, a university or a college of nursing, for instance, or a college of pharmacists. And the lead can also be oh, sorry. The lead can also be a membership association. So for instance, a pharmacist association or a regulatory body. So for instance, a council of pharmacy. And it's quite similar for the LMIC partners. The only difference is that non-profit hospitals are also acceptable as lead partner. And then in question 2.2, so if you have any more questions, we can enter any question in the Q&A if it's not clear. And if you are not sure which category your organization fall into, then you can email us and we can discuss in more detail your particular situation. Then in question 2.2, we ask you to provide details on the lead partners for the UK and LMIC, and also the details of any additional or managing partners. And we also would like to get the contact details of these parties. Then we ask you to identify in question 2.3 which lead partner will be responsible for signing the contracts. And so again, this can be the UK partner or the LMIC partner. I know previously, I think it was only possible for the UK partner to be contract signatory, but in this extension, we can sign the contract with the LMIC lead partner and therefore transfer the fund directly to the lead partner, LMIC lead partner. In question 2.4, so this is a space for you to tell us about any other partners who will have an input into your project, partners who have worked with you to develop the project. So this might include, for instance, an NGO who is working on the ground, a governmental department such as the Ministry of Health, or technical groups, for instance. And we are also interested to know more about the project team members, particularly that are involved in each institution. So we ask you to provide details on their positions and their responsibility within the project in the third column. For question 2.5, we've asked these questions to get more details on the partners, institutions, and individuals' experience in relation to AMS, AMR, IPC, and microbiology. And these sections will allow us to assess the capacity of the partners and previous relevant work that might be that might have been conducted successfully by these individuals or these institutions, and this will strengthen your application. So make sure you insert all of the details on the experience. Then question 2.6, so it's specifically for established partnerships, and it's your chance just to tell us more about your partnership. And you should assume that THET or CPA don't know anything about your partnership, even if you have been funded by us previously. So you should mention the history of the partnership, how it was set up, how you established the need to start this partnership, and what you have achieved as well. It's really the section where you should sell your partnership. You could detail how many years you've been working together, include details on specific projects or specific achievements. And it's always a good thing to include numbers or data on achievements of points and the number of people trained or anything like that, that will strengthen your answer to this question. In question 2.7, so it's specific for new partnership. And you should detail any relevant experience in global health and in implementing projects in LMICs. And also how the partners have met and developed the proposal together. So it should be clear that your application has been developed jointly by both lead partners and any additional partners as well. And everyone should have been actively involved in and engaged in the design of the proposal. So we usually spot quite easily proposals that have been written by only one of the partners. So you should make sure that you have input from everyone listed as a partner. And we want to see evidence that you have engaged also with stakeholders and any additional experts on your project. And finally, question 2.8. So it's only for applicants from category B because it's a question on their previous Cpams project. So again, if you can include any specific details on your projects, achievements from the project, then that will help us assess your application and your experience. And then justification. So make sure that you provide the completed AMS assessment with the application form. So it's linked on the website. It's the annex 1. And if the AMS assessment is not attached to your form, and if you can't provide it, then your application will not be eligible. So make sure that you provide this annex when you apply. And Diane will go through the assessment tool later on. And question 3.2. So here you should describe and summarize the findings from the need assessment. What are the opportunities that you have identified and how are you seeking to address them? And just an opportunity to summarize the AMS assessments and to link your findings with your project approach. And then question 3.3 is for you to detail a bit, to give a bit more detail on the methodologies that you have used to conduct the assessment, the needs assessment. So you could talk, for instance, of the local stakeholders that have been involved in the process and how you have engaged the stakeholders. And finally, in question 3.4, we'll be looking to assess how your project has considered the other ongoing projects in the LMIC country that you are targeting, and how your project will work to strengthen efforts rather than duplicating efforts within the area, and why the suggested approach is relevant as well to the context. And this is so you should take this question, the opportunity to show that you have a good understanding of the country's priorities and the challenges as well of the context. And it will be also good to look at other Fleming Fund programs currently working in that country. And now I will hand over to Jess for the project description.
Okay, so for the project description, so thinking about the monitoring and evaluation plan, partnerships should demonstrate that they have a system in place for setting and measuring objectives. So in this section, we are asking you to describe the changes you expect to see as a result of your project and in relation to your overall aim. So all changes should be SMART, which means specific, measurable, achievable, realistic, and timely, and consider the scoping recommendations. Outputs are the changes that you'd expect to see soon after an intervention or activity. Outcomes are the changes by the end of the project, so changes that come later on. These should be linked to your middle changes and reflect the next stage. In this section, we'd also like you to describe the kind of MEL systems that you have in place, the type of data which you will be attempting to gather, and how you will go about collecting that data. For more explanation on the MEL plan, please see the Q&A document, which goes through this a bit more in full. For project activities, so in this section, please list all the activities which you are planning to do as part of your project. So the more specific you are, the more idea that we'll be able to gain on what your project entails. So feel free to add more lines if necessary, and be aware that we might come back to you with more specific questions about individual specific activities. For the involvement of multidisciplinary teams, we look for evidence that the project will engage a multidisciplinary team and explanations on how the pharmacy professionals are engaged throughout the project, and especially as part of the project team. For outcomes and learnings incorporated to change initiatives in the UK, so health partnerships need to think clearly about how they will learn from one another and should approach their activities and project as an opportunity for mutual learning that will enable health institutions from both sides of the partnership to identify and to test, adopt change that strengthens the delivery of health services and quality of care provided. A key aim of the CwPAMS programme is to ensure that evidence is generated and gathered to demonstrate what impact the involvement of NHS volunteers in the CW's programme has on the UK health system, both in terms of individual health workers and the wider health institutions and systems. So really important to consider this and think through this as a partnership when filling this part of the application out. In the next section, which is sustainability and local ownership, we are particularly keen to fund projects where the partners have thought about sustainability into the future once the project funding cycle has come to an end. So we ask that you use this section to explain how you have thought about this and what plans are in place for ensuring sustainable outcomes. We expect all partners to contribute to the design and management of the project. So partners must ensure that all projects align with the national action plans and priorities and show how they have engaged with key local stakeholders, which is including the Ministry of Health. Engagement with senior management within the institutions that the project is being implemented in will be expected, and the project's data collection system should complement rather than compete with the existing systems in those respective institutions. The application should clearly articulate how changes achieved through the project will be embedded in the country's health systems. For gender equality and social inclusion issues, so as we've been referring to it as GESI, as we work to make sure GESI is an important component of all of our funding schemes, partnerships should consider GESI issues in their application and detail how the project will respond to these issues. So partnerships could consider including a line in their budget to ensure that all genders are equally targeted by the project. This might be through specific needs assessment or targeted interventions or through gender-specific policies, amongst others. And partners should aim to include indicators related to GESI in their MEL plan, which is the question 4.1. To help partnerships to consider and incorporate these GESI elements, THET has developed a GESI toolkit, which we'll share in the chat, and you can find it on our website. And we have also developed a GESI AMS training, which you can find, it's linked in the application form, but you can also find on our website, and we'll also link to that. So that talks through using the toolkit and specifically in relation to AMS. So please have a look at these resources as you complete your application. In terms of thinking about good practice and literature use, in this section, you can list any national and international guidelines you've taken into consideration when developing your project, especially related to your target country. You can refer to the relevant WHO guidelines, for example, the WHO AMR guidelines, but make sure that these guidelines are relevant for the local context. You can also refer to the WHO building blocks and explain how you've considered the wider health system which your project will impact on. For consideration around COVID-19, This section is for you to detail any contingency plans in place for some of the activities that have been cancelled due to the travel restrictions related to COVID-19. All partners should consider the project risks of working on a global health project during a pandemic, and partners should think about alternative activities and how the budget would be reallocated if international travel and in-person activities cannot go ahead. For project management and support, the information that you provide here will help to assess your partnership's capacity to deliver the project. So please note that if your project is shortlisted, we will ask you to provide documents to support this. So, for example, a memorandum of understanding between partners or letters of support between partners. For individual and organizational project management experience and capacity, this is the same as above, but focusing here more specifically on each partner organization and on individuals involved in the project. So that might be the project lead specifically and the experience that they have. You can provide examples of similar projects and budgets that your partnership has been managing, and any other experiences related to project management, monitoring and evaluation, and financial management that your partnership has carried out. For 5.3, engagement of short and long-term volunteers. So when discussing volunteers, please make it clear whether the project will make use of short-term or long-term volunteers and how the volunteers will be engaged with. So whether they will support the project remotely or in person. And as mentioned previously, CwPAMS aims to leverage volunteers and ensure mutual benefits for both the UK health system and the LMIC country, and on a more individual level for volunteers and their own learning and development. So important to consider these areas when thinking about this section. Here we would like information on how the project will benefit UK volunteers involved in the project. So volunteer management requires having important systems in place, such as duty of care, volunteer recruitment, and management policies and procedures. So we might ask for more information and documentation on your volunteer recruitment and management processes if your proposal is shortlisted. I'll now pass back to Audrey.
Thank you, Jess. So for the budget section, you can see on the screen the 4 is questions that reviewers will use to evaluate the rationale of the project in terms of value for money. And this section should complement the budget and should highlight any value for money arguments that you have not included in throughout the application or in the budget. Then section 7 is a checklist for project activity requirements. So this is just to help you make sure that you have included all of the relevant requirements that are listed in the call for applications document, and to give any additional detail that you may not have included in other questions in the form. Yes, next slide. Okay, so now we are done with the application form. We are going through the budget template. So when you complete your application, we recommend that you complete the narrative part first, and then you can start on the budget and consider the costs related to the activities that you have included in the narrative part of the application. We have provided a simple budget template that you can see on the screen, and please note that the formulas are used to calculate the totals and the percentage of the variance, and these are protected to ensure accuracy. So the first section of the budget is the project management section or category. So it's for you to add your standard project management cost, for instance, the staff cost, office cost, communication cost, etc. And as mentioned previously, the cost for this category should not exceed 40% of the overall budget. And also you should note that any costs related to staff should be included either in the project management category or in the mail category, but not in the activities category. Then you have the equipment costs. So equipment category, which should not exceed 50% of the overall budget. And please be aware that any equipment that is purchased through this program should be considered in terms of sustainability. So you should detail in the application or in the budget in the comments if you want, how the equipment will continue to be sustained after the project has finished, and particularly in terms of maintenance of the equipment and any consumables that you might purchase. And then you have the travel category. So as mentioned previously, international travel should be justified and in line with any regulations at the time of travel. And it should also be in line with the Leeds organizational policies and with THET's travel policy. And make sure you consider any additional costs related to COVID, so for instance, the PCR tests that are needed to travel in some countries. I think someone asked if we will fund travel to red list countries. I'm not really sure, so we will discuss that and we'll get back to you on this. But any trip needs to be justified and needs to be discussed with THET. So if you plan to travel to a country in red list, I think you will need to discuss that with us before making any purchase of tickets or anything. Okay, so in terms of the project activities category, this relates to the activities that you have put in your activity plan in section 4.2 of the application form. And here we would like to see the activities costs broken down. So for instance, if one of your activities is a training workshop, it's better for you to write each cost related to this workshop rather than just writing train the trainer workshop, £2,000. You should write, for instance, venue, local transport, catering, stationery, everything that is related to this workshop, and break down the cost for each of these subcategories. And you can add extra lines in this category, but make sure that the formulas are copied down. The following category is for costs related to monitoring and evaluation. And as previously mentioned, we would expect M&E to be budgeted as part of the project, and it should be it can make up to 40% of the overall budget, and this includes research and dissemination. And then in terms of other points related to the budget, so you may add costs related to contingency up to 1.5% for exchange rates or bank charge in the project management category. You can also track the overall percentages of the budget in the budget category summary, section. So you can see it at the bottom of the budget template. So you can, that way you can ensure that you don't exceed the limits for any of the categories. And if you have any additional funds that is funding the project, you can add that to the bottom of the budget template as well. You can see it on the screen. And finally, THET will transfer the funds to the contract signatory, which can be either the UK lead partner or the LMIC lead partner. And the recipient of the grant will then have to transfer the funds to the other partners. And now I will hand over to Diane, who is going to talk through the Ims Assessment Tool.
Thank you, Audrey. There have been some questions, but I think we'll take those questions towards the end. So with the Antimicrobial Stewardship Assessment Tool, there's an initial part which is really about getting the facility and partnership details, so really some demographic information. In the true sense of partnership, we do collaboration between both the in-country and the UK partner will be useful here, and you may want to decide how you do that, either through an initial completion and then a discussion. The partnerships from the previous CwPAMS used a range of approaches with this, but bearing in mind obviously that this is about the assessment of stewardship in country, not the UK. So this is about in the 8 countries, what is the institutions in the 8 countries, what is the stewardship assessment? Next slide, please. And then it goes into different sections. So it takes you through leadership commitment. And we've we've adapted the WHO criteria slightly, because with the WHO, they used, yes, priority, but not started. We felt that was too complicated. It was fairly complicated for what was needed here. And so we've gone with a yes, no, somewhat, unknown, not applicable. Obviously, with not applicable would be if we've asked a question that is not relevant to that institution, but we would expect to see very few not applicable. And really it's going to be an opportunity to state if something exists or not. So our antimicrobial stewardship activities in the healthcare facilities, included in the healthcare facilities annual plans with key performance indicators. And if it doesn't exist, if you cannot evidence it through a written document, then it will be a no, if that makes sense. So we really need to avoid ambiguity. And so there are some verifiers. The verifiers are there as a supportive information, not a directive, if that makes sense. It's really there for you to think through that indicator and to see if that how that applies to the question. And so obviously if there are other examples that you can use, then that would be fine as well. But in the comments and additional information is where you can bring in those examples from the particular institution. And we recommend that you consider actually writing in some additional notes for yourself, because this is a useful information for you to use going forward, and it's a baseline of what is available in that institution before activities start. And so part of the reason why we've asked that this is done at the application stage is that actually once you have started to work through things, then you may find that you actually start to implement a range of things already. I'm just going to, and there's an introduction section to the tool as well that I don't think we included there, which has provided some information about the justification for providing the baseline tool, and also the importance of completing all sections within the tool. Next slide, please. So it goes to leadership commitment. So there's a couple more. So we've highlighted some points and put some in bold because they look like they are similar to other questions, but they're not. So there is no duplication really within the questions. Some of them we just need to read them, and you'll find that they're asking slightly different things depending on what section they're in. Next slide, please. So then accountability and responsibility, and really I can see that we've got an error there with the committee written twice. There's a difference, really trying to ask if there's a committee or standalone group that focuses on antimicrobial stewardship. And then there's a question on if there's an antimicrobial stewardship team, and there's slightly different things between the committee and a team. Next slide, please. So yeah, so there's a team have clear written responsibilities or terms of reference, and there's obviously the committee, which will be slightly higher than the team. So there are 2 different things there. And then who are the members of the antimicrobial stewardship team? Next slide, please. And then some information around antimicrobial stewardship actions. Is there a standard treatment guideline in place? Next slide. So this just goes through a range of things. Do you have regular audits, and then do you feedback that data to clinicians? Next slide. And obviously if there's a statement that is not clear, then please feel free to use that not clear or understood as well as an option. Next slide, please. And then there's a section on education and training as well. Next slide, please. And then monitoring and surveillance. So have you assessed the appropriateness of antibiotic prescribing, or do you collect any data on antimicrobial surveillance? And there's slightly different questions there. Next slide, please. Next slide. So that's all on surveillance. And then there's one around reporting feedback within healthcare facilities. So there's collecting the data and then there's feeding back the data. Hopefully you can begin to see why we've got some requirements. There's some of the requirements we have within the CwPAMS program. Next slide, please. And then there are a section for you to consider the opportunities and threats to antimicrobial stewardship within the facility, and the action plan. So with this section that talks about the key actions that will be taken, that is really just it's probably summary points from your project plan. We don't expect your project plan to be repeated here, but what are the key activities, just the top lines, can they be included within that section? Next slide, please. And then we've asked some questions. These are really more linked and specific back to CwPAMS. So has the facility previously participated in CwPAMS project? Has the facility contributed to global PPS previously? And then how many point prevalence surveys have been conducted in this institution before? Next slide, please. So there's a range of questions linked to that in terms of how many guidelines or tools available. And we asked that both for antimicrobial prescribing and stewardship, and also infection prevention and control. Next slide. And then obviously with the focus on pharmacy, we're just asking what the level of capacity is for pharmacists and pharmacy technicians within that institution as well. Next slide, please. So yeah, that concludes the stewardship assessment section, and really, hopefully that gives you information. We do not expect it to take you more than 1 to 2 hours to complete this. So if there is a stewardship leads, will usually be able to complete the assessment tool quite quickly, but you may need to discuss further with other colleagues within the institution if needed. But we do not expect this to take more than 1 to 2 hours. And as I said, if it's an antimicrobial stewardship lead within an institution, if there is one, or a pharmacy lead, they should be able to complete this fairly quickly as well. So there was a question in the Q&A around it seems to be geared towards secondary care, so it seems to be geared towards hospital. I would say that if you're focusing on community pharmacy, you would want to complete the tool as well. Obviously, there may be more within that you would say is not applicable. We will consider if we need to create one specifically for community pharmacy, but I think that the principles are the same in that, are they looking at their data? Is there any stewardship activities in place? So that's a very good question. We expect that the community pharmacy will mostly affect category B applicants. So if you think that you may be focusing on community pharmacy, please can you highlight that to THET and CPA, and we can consider how we support you with that. It says here, can institutions have only outpatients and no inpatient facilities? Can they apply? So that's an interesting one, and potentially yes. You can apply if what is clear is that it has to be a delivery institution. So if it's a primary healthcare center where there's focus on outpatients, then there is a possibility for you to do that, and no inpatient. But you will need to consider how you would carry out an antimicrobial stewardship assessment within that setting, and I think that would be important as well. So I think those were the questions that I've seen that are linked specifically to stewardship. There was another question from a colleague asking if learned societies can apply, and knowing the institution that question has come from, the answer is yes. But what would be key is that from a UK side, you would need to show that you have an NHS institution as part of the partnership. I will stop there for now and hand back to B or Audrey.
Thank you, Diane. So yeah, now we finished with the overall application forms and the documents related to application. So we're going to quickly talk through the timeline and the next steps.
Sorry, Audrey, actually, I've got a colleague who's had his hand up for quite a while now. Maybe we want to take his question.
Yeah, sure.
Emmanuel Okim, if you wanted to just ask your question. Emmanuel? Are people able to unmute themselves?
I am unmuted, Emmanuel, so
okay.
I should be able to talk.
He's had his hand up for a while, so he may have.
Yeah.
So apologies for that. We were looking focused on the questions and Q&A sessions. Okay, there's a question about when does the grant end? please check the date. It's 2022.
Yes, definitely.
June 2022. That's when it ends. That's when we expect the final reports. Okay, back to you, Audrey.
Thank you, Diane. Okay, so the extension program, the call for applications, opened last week on the 19th of July, and it will close. So the deadline for application is on Thursday, the 2nd of September at noon BST, so British Summer Time. And the applicants should submit their application form, the budget template, and the AMS assessment tool with letters of support from the lead institutions, so from the UK and the LMIC country. And they should email all of these documents to grants@thet.org. So the email address is provided on the screen, but also in the application documents. And once you have submitted your application, you should receive a confirmation of receipt within 2 working days. And if you have not received the confirmation, then you should email us again, especially if the deadline has passed and you have not heard from us. And then an internal selection committee will do a preliminary shortlisting of the applications. And the applications that have been shortlisted will then be reviewed by a technical expertise group. And during this review, we might need to ask you further clarifications on the application. So it's important that at least one person from the partnership be available during this review period, so around September time. So make sure that someone can provide clarifications in September if we email you. And once the technical review is complete, then an independent selection panel will meet to decide on the final outcomes, and applicants should be notified by late September or early October of the outcomes of their application. And THET and CPA will then work with successful applicants to conduct a due diligence assessment, finalize the budget, and integrate any technical feedback into the project plans. After this, the grants, during this, the grants contract will be signed, and then the project can begin. Projects are expected to run from mid-October 2021 for a period of 6 to 7 months, and all projects must be completed by mid-May 2022, with the final reports due in June 2022, the 1st of June. And I think that's everything. So we're now looking at the questions, and then we can have a bit of time for networking at the end. So let's see if we have any more questions. Emmanuel, I think you still have your hand up. I don't know if you can hear us and if you want to ask something.
Oh, sorry. Sorry, mistake.
Okay, no problem. Okay, so let's check the questions. So feel free to add any more questions in the Q&A chat or in the chat box, and we will try to answer your question. But if we don't answer your question, then feel free to email us with any additional questions, or if you think about anything else after the call, then feel free to email us anytime. Can't see any more questions in the Q&A chat. Let's check the chat box.
There's one in the chat rather than the Q&A.
Let me check. Thank you.
So look, I can read it out, Audrey. It says, on the slide, what outcomes are expected? Are we expected to strengthen workforce in all 3 of the first areas, or can we decide between? You can decide. But the focus obviously is being around antimicrobial prescribing or stewardship. Yeah, as long as it fits within that, then yes.
Thank you, Diane. I think Rachel asked, after filling the request for partnership form, how long will it take to get feedback? I assume this is for a new partnership, to form a new partnership. So we ask applicants that are interested in starting a new partnership or are looking for partners to complete the survey that we have linked in the chat previously, and it's also on the website, and we will send it by email as well again after the call. And we share and update the results regularly. So you will receive an email with the contact details of everyone who has replied to the survey, but we can't guarantee, unfortunately, that you will find a partner. I know that a lot of people from Nigeria, for instance, are still looking for partners, but there was not a lot of UK partners interested in responding to the survey. Therefore, we don't have their contact details to share with LMIC partners for now. We are still looking to obviously match partners, but we can't guarantee that you will find one. But yes, do complete the survey, and then we will send the result to everyone. And hopefully you can start chatting with potential partners. And then someone asked, can volunteers include staff not employed by the UK institution, but registered with professional bodies who have expertise related to projects? I think we might have answered that previously, but I'm not sure. So volunteers can come from the UK and also the LMIC institution, but volunteers from the NHS Trust, I think, must be included in the project. So you can include volunteers from other countries, but they also need to come from the UK. If that makes sense, unless Diane, you want to add something to that.
Yeah, so you can have other volunteers not employed by the UK institution but registered. Yes, so you can have other people as part of your partnership. Obviously, they probably can't be part of the lead, but yes, they can certainly be part of the projects, and that certainly happened in others because people were interested and wanted to volunteer their time, and that's totally fine to do that, as long as you do have that NHS institution in place.
Mm-hmm. Yeah, thank you. I think that's everything in terms of questions. So we have around 10 minutes for networking. If people are happy with that, we can do that now. And so earlier in the webinar, we said that we would open breakout rooms, but we can't do it in the webinar form. So we have created another meeting to enable people to join that other meeting and breakout rooms in that meeting. So the link is in the last slide. Jihun, if you can show the link, and I will also put it in the chat box. So if you want to network and try to chat with people that are interested in starting a partnership or looking for partners for CPAMS, then you can join this meeting and join the breakout room of the country you are interested in. I hope it's clear. And once we close this webinar, then we will open the CPAMS networking meeting and open the breakout rooms. So please, if you are interested in networking, then join the other meeting. And thank you everyone for attending today. As we said earlier, we will share the slides and the recording and send a follow-up email to everyone with links to everything that we have mentioned. So even if you miss some of the presentation, then don't worry, you will have the information. And feel free to email us with any other questions. Okay, so hopefully people can see the link to the other meeting, the CPAMS networking meeting. So please click on that link and join if you are interested to discuss with partners. If not, you can leave and have a break. And I will close the webinar now, and I will see hopefully other people in the meeting, the other meeting. Thank you, everyone.